Hello, it's my pleasure to welcome you to another installment in our 5-part webinar series presented to you by APHSA in partnership with the Maryland Department of Disabilities. This series will share cutting-edge innovations that demonstrate how services across the country can much more effectively assist young people with disabilities aged 14 through 24 and their families to successfully transition out of K-12 education into post-secondary education or work. These families interact not only with disability services, but also with our human services and supports. And the innovations to be discussed emerge from a 5-year federally funded model demonstration project called PROMISE. The innovations speak directly to how our agencies can better align and coordinate with other systems to truly improve outcomes for these young people, who are most at risk to face a lifetime of dependency on public benefits. The work of the PROMISE model demonstration project produced significant learnings that are highly relevant to all those who work at the intersection of the many sectors and systems addressing issues of disability, economic and social mobility, education, public health and well-being, and children, youth, and families. The lessons learned are also highly relevant to other whole family frameworks you're probably already using, such as two-generation and whole family approaches. Since early 2019, APHSA has been partnering with the Maryland Department of Disabilities and the leaders of the 5 other PROMISE projects. We've partnered to engage human services professionals and share approaches and lessons learned from PROMISE in ways that help you explore how to apply these lessons in order to more efficiently and effectively serve people with disabilities, including those with non-obvious disabilities, within the population that you serve. This webinar series captures the depth of learning and expertise from across the PROMISE sites and is organized into important topical areas. Each webinar will also provide a number of tools and resources to help you move the needle in your jurisdiction. We encourage you to watch the whole series and to share it with partners across other sectors and settings. Today's webinar will equip you to better understand non-obvious disabilities and how and when individuals may want or need to disclose them. This understanding is important as it allows you to focus support on serving youth and their families holistically and meeting them where they are. Our two presenters today are Jade Gingrich and Brent Williams. Jade Ann Gingrich has over 2 decades of experience in state policymaking, starting as Executive Director of the Governor's Committee on Employment and People with Disabilities, and most recently as Director of Employment Policy for the Maryland Department of Disabilities, the nation's only cabinet-level cross-disability department. And Brent Thomas Williams is currently the Rehabilitation Counseling Concentration Coordinator for the Counselor Education and Supervision Program, and is an assistant professor in the Department of Rehabilitation, Human Resources, and Communication Disorders at the University of Arkansas at Fayetteville. And with that, Jade, I'm going to hand it over to you.
Thank you, Christina. Just to give you an overview of the webinar series, as Christina mentioned, there are 5 webinars, and our topics include our overview and introduction. It talks a little bit about the history of PROMISE and the population and some of the lessons learned and how we think that the information garnered from PROMISE will be able to help you and your states improve outcomes for youth and families on SSI. The other topics include work incentives and benefits counseling, education and family engagement, and customized employment, which is a model of employment that has broad applications for anyone with barriers to work that focuses on employers' needs and individual strengths. The key elements of each of these webinars are the webinar itself, as well as specialized tools and templates, resources, and questions and answers for guiding discussions among your team. The tools and templates are things that can be modified and or utilized in your state. The resources are places that you can go for more information. And our goal is that you convene state or local teams comprised of representatives of human service agencies and disability agencies, including but not limited to workforce vocational rehabilitation, as well as the workforce development partners such as labor. This is an opportunity to integrate this information and knowledge into other efforts that may already be underway in your state, such as 2Gen, TANF state plans, and more. It's important to think about these not as separate standalone efforts, but rather activities that can be integrated into your existing work that will help you to improve the outcomes for the populations you serve and support. There will be a link to the supporting materials at www.mdtransitions.org, which will also include a link to APHSA. Just as an overview again, PROMISE was a large-scale national research grant with over 13,000 youth on SSI and their families recruited to improve their educational and employment outcomes. California, Maryland, Arkansas, Wisconsin, a collaboration of states called ASPIRE that included Colorado, Arizona, South Dakota, North Dakota, Montana, and was led by Utah, and New York. The demographics in each of these sites included significantly high representations of minorities, in particular Blacks, Hispanics, and with ASPIRE, also Native Americans. Non-obvious disabilities comprised one of the largest populations in each location, which gets us to today's topic, working with individuals with non-obvious disabilities. And with that, I'm going to turn it over to Brent.
Thank you, Jade. Noam Chomsky is famous for having said that it's not just semantics, it's always semantics. Words matter, and so to introduce today's presentation, we want to be specific and very clear with our nomenclature. Oftentimes in the field of disability, there isn't consensual agreement on phraseology, on nomenclature, on the terms that we use, and it can lead to misunderstandings and a lack of clarity that really doesn't facilitate the process. There are three terms that are often used interchangeably. Often you'll hear the terms hidden disabilities or invisible disabilities, and these terms are often used synonymously with the term non-obvious disabilities. For today's presentation, we're going to make a discrete and very purposeful use of non-obvious disabilities. And the reason we want to talk about that is within disability, within the field as a whole, stigma, baggage still exists for the use of many words. As professionals, as individuals who experience disabilities understand, as our understanding of the interplay between disability and environment, disability and the culture as a whole, we want to use words that empower and embrace as opposed to isolate and stigmatize. Oftentimes the term hidden disability carries with it a notion of purposefulness or secrecy, that something is not intentionally being revealed. There's an intentionality associated with it. Likewise, the term invisible disability can connotate a lack of reality. If it's invisible, is it real? What we're stating and what we're going to be talking about today are disabilities that simply are not apparent. These are not hidden by any source of intentionality. They're not invisible. They're not real in some way. These are real disabilities that impact people's lives and have an impact on their ability to be included in our culture and our society. They are non-obvious disabilities. Now, to give you an idea of the prevalence of what we're looking at, of how frequently within the society and our culture non-obvious disabilities occur, and let me caveat this. There's a link here on this slide, and most of the time when prevalence disability data is presented in these presentations, I am the first to say that the freshness dating on that usually is about 10 minutes. Disability data is hard to come by. It's fluid, depending on the source, the U.S. Census, depending on the source, Rehabilitation Services Administration, depending on where you get the data. Numbers can fluctuate. These numbers that we're presenting today are good ballpark numbers that kind of represent the population as a whole. We'll be talking a little bit later in the presentation about disclosure. That's one of the biggest hurdles to determining the prevalence of disability, because there is still great stigma and barriers to folks disclosing. All those caveats made, as you can see here on the slide, it would appear from the data that is currently available that about 10% of Americans have a medical condition that is not obvious. So within the population of a whole, 10% have a medical condition that is not obvious. 96% of people who have disabilities have a disability, once again, that is not readily apparent, that is not obvious. 25% of that population, now what you noticed before we used the phraseology, and it's important to understand this, these are talking about medical conditions. 25% of individuals that have a medical condition, of the 19th medical condition, have a limitation to daily functioning that would be mild to severe and would be referred to, and of course, eligibility is something we'll talk about a little bit later on, would be considered to have a mild to severe disability. So the important thing to get from this kind of maelstrom of stats and data is to understand that when you walk down the street, when you enter a room, when you're talking with colleagues, most likely if there's more than 10 people in that room, someone in that room has a non-obvious disability. One of the things that we think of is disability is often parsed into disabilities that involve cognition, disabilities that involve sensory input, disabilities that involve motoric function. Non-obvious disabilities cuts across all types of disabilities and includes one of the broadest array of disabilities of any kind of categorization or conceptualization. For instance, non-obvious disabilities can include learning disabilities, psychiatric disabilities, traumatic brain injuries, ADHD, ADD. They include epilepsy, multiple sclerosis, multiple chemical sensitivities, hearing loss or vision loss, things such as individuals who have conditions that lie on the autism spectrum. Any of these disabilities would fall under the category of non-obvious disabilities. And just the list, I think we had it caveated here at the very bottom of C, not an exhaustive list. The exhaustive list would be about 12 slides long, and since we have limited time today, this is just an idea of the very broad array of disabilities that we're talking about when we talk about non-obvious disabilities. How does this impact youth and families? Well, as you would imagine, I mean, as we spoke of earlier, the very fact that they are not readily apparent. But this blends in, as in most instances, two things exist in a vacuum. The very nature of these disabilities are that they're not readily apparent. But their disclosure, their becoming apparent, is often bound by stigma. As we also know, there is a nexus between disability and individuals who exist on the lower tiers of the economic stratas of our society, who are poorly resourced. If you are poorly resourced, you're within the lower economic stratas of our society, and taking on an additional barrier, acknowledging it, putting it forth, increases your stigma. If you're already being stigmatized, if you've already been isolated or discriminated against because of your race, because of your level of economic resources, coming forth and saying, oh yes, here's another culturally stigmatizing, culturally isolating, here's another barrier. The stigma associated with non-obvious disabilities is one of the greatest preventions from them becoming apparent. Also, we have to understand that within a cultural framework, very often disability is considered valid, or as we spoke a little bit earlier in a nomenclature slide, considered to be real if you can see it and if it's consistent. Many folks, for instance, that have multiple sclerosis report that if they use a chair on the days that they have difficulty and are easily fatigued, but the next day do not use a chair because they can walk 10 or 15 steps, individuals will confront them and say, well, you obviously, you didn't have the disability yesterday, you have it today, you must be gaming the system. There's something has to be going on. So there's an enormous amount of stigma associated with disabilities that are not apparent, just in the nature of the disability itself. So with the nexus of economic strata, with the stigma associated with disabilities that are not apparent, it's very difficult for youth and families to disclose and to receive the services that they often need. And this goes on to the fact that, as you saw from the list, many types of non-obvious disabilities are genetic and can be inherited, run through families. And then also, many times, non-obvious disabilities are potentiated or further exacerbated by having poor economic resources. So they're looking at a multi-generational part of this. Now, what also is frequently difficult for families and youth with non-age disabilities is youth who receive supplemental security income as children. The eligibility and the criteria for that are very different before the age of 18, at the time of redetermination, post 18. And so many times services and resources that are available to the children will not be available post redetermination. And this goes on to the final point that you see on the slide, is that these limitations for adult disability services often are not known by the families, not understood, and they encounter this cliff. Many families often refer to redetermination as a chasm, as a cliff, that services at one point came to them, and then past redetermination, there's an abyss, and the inability to cross this abyss to adult services. If we want to think about the broader terms, and we touched a little bit on this, but in the broader terms, why does disability matter? And we talked a little bit about this cliff that families often refer to falling off, or the chasm that they feel they can't cross. To a large degree, it is eligibility, because the eligibility is very different from services for children under the age of 18 and services post 18. That without knowledge, without understanding, without the ability to have some sort of facilitated mechanism, many families don't understand the eligibility criteria, don't know how to meet them, and don't know how appropriately to plan with and under different eligibility services, different eligibility criteria to get services. One of the most problematic issues for families is the differences between services that are provided K through 12 as opposed to those that are provided in higher education. We're going to talk a little bit more about this, but one of the most important parts is the service delivery differences. In K through 12, the services are provided as a function of the educatory process. Eligibility is determined and services provided. Under higher education, for instance, the services must be requested and are not in the same vein as those for K through 12, in so much as that these services must be procured by the youth or the families making the request, by the criteria, and are designed not to be specific services, but are designed to level the playing field. And we'll talk a little bit more about that. One of the things that we see because of this, because the very real change in how services are provided in K through 12 as opposed to higher education, is the students don't have the information to access the services. There's a higher rate of dropout and recidivism, and students often find that this very different way in which services are procured and delivered makes succeeding in higher education much more difficult. By the same token, these same criteria are also problematic within the workplace. Oftentimes, in much the same way within higher education, whereas a youth K through 12 through his high school years had the services delivered to them, the eligibility was made for, the youth could anticipate having service presented on an on-need basis. When that very same youth graduates from high school, enters the workplace, now the disability must be disclosed, accommodations must be discussed. This is a request for services. Accommodations must be requested. A dialogue must be engaged. The very nature of how that youth will be provided accommodations and be allowed to be included in the workforce is largely based on the ability for that youth and family to have information and to use that information to provide accommodations. One of the things, too, that we often note, and we talked a little bit about resources, and this is the final point on this slide, is that oftentimes these families because of the nature of disability, are under-resourced and exist at the lower strata of the economic tiers in our society. Healthcare costs, as you saw from the list, for non-obvious disabilities can be just as high, if not higher, than for obvious disabilities. And so frequently families that are already under-resourced, families that already have difficulty with acquiring accommodations necessary to succeed, are paying much higher health costs than those families without disabilities. This further economic burden can prevent them from full inclusion, both in the workplace and in higher education. Of course, we've talked about this before, and you heard Jay talk a little bit about this previously. Both working with families as a whole family approach, working in a two-generational approach, these are all the larger, broader contexts in which to approach and understand dealing with families with youth with non-obvious disabilities. Some key points that are important to understand is inclusive design. Now, I talked a little bit about semantics earlier. Oftentimes the terms universal design and inclusive design are interchanged. Typically, inclusive design is considered to be the preferred term in the sense that it connotates an intentionality to include. Universal design is often considered to be a passive approach. Well, if I just do it in this somehow mystical, purposeful way, it'll work for everybody. Inclusive design says no. You have to be more intentional. You have to mean it. You have to put some thought. The link that you see there under inclusive design breaks down some key elements that I just want to make sure that we cover. These key elements for inclusive design have to do with engagement, representation, and action and expression. What we want to make sure when we understand inclusive design is that not all students engage with information in the same way. Some will need to be actively engaged. Some need to be engaged auditorily. Some need to be engaged physically. Some need to be engaged visually. This needs to be a broad array. Not all students have their interests piqued, have their attention focused in the same way. That is part of intentional inclusive design for education. Also, how the information is presented. Having piqued someone's interest, having gotten someone's attention, how you engage them is one thing, how you represent the information. Some individuals understand information represented visually much better, some auditorily, some graphically. And finally, information, once attention has been gained, once information has been taught, has been represented, the full circle must be achieved, which is the representation of information, expression of information. How can you tell if someone can demonstrate? Some folks can demonstrate their mastery of a topic quite readily for verbal means. Others are much better through a demonstration of the action itself, some individuals have preference to demonstrate learning through written. If in fact we are going to reach and be as inclusive as possible, inclusive design must take into account all of these factors and provide the methodology best suited for each individual. This is also true in how we conceptualize disability and how we conceptualize ability. One of the primary ways to best effectively serve youth with non-obvious disabilities is from a strengths-based versus a deficit-based approach. Often this is referred to as understanding what someone can do as opposed to what they can't do. You look and understand what a student's with a non-obvious disability's best abilities are. Design and understand tasks and outcomes that are best suited for that student's abilities. Oftentimes within a workplace, this is understood as job carving or task analysis. Instead of understanding what the limitations are according to the task assigned, understand what the individual can do based on their abilities. As we talked about before, one of the most important ways to either know what is your best learning style, to know what your abilities are is to understand what the person's styles are, what their abilities are. This means testing, and this means documentation. Because non-obvious disabilities are in fact not readily apparent, the single best tool, or one of the single best tools available to facilitating their inclusion into the workplace, into higher education, is knowledge, is documentation, is testing. One of the single best things we can do to facilitate this, and this is both true in terms of eligibility, this is true in accommodations within higher education, this is true within accommodations in the workplace, is to understand the person's abilities. This is key, and this involves not just simply testing of an intellectual basis, but it involves testing on a broad variety of abilities. When students are identified as having struggling in a particular venue, the single best way to facilitate progression onto higher educational workforce is to get appropriate testing and documentation of their abilities. In higher education, non-obvious disabilities, one of the things that we touched on that I said that we would get back to is the difference between IDEA and Section 504. One of the primary differences between IDEA and Section 504 is that Section 504 is a civil rights law. And IDEA is a law that stipulates the services that are provided. So under Section 504, the idea for 504 is its civil rights. It is designed to provide an equal playing field. It is designed to work and make sure that discrimination is not manifest. It is not designed to provide specific services in the way that IDEA is. IDEA, so many times students who are provided service under IDEA in K through 12 find that upon entering higher education or the workplace, in which that Section 504 is under, that many times the services, the onus on providing documentation for eligibility, the responsibility for requesting accommodations, the work that must be done to facilitate and achieve inclusion is now placed on the youth and family as opposed to the delivery system that was available K through 12. One of the things that must be done in higher education is the youth must contact the disability support services. Once again, this is a different setup than was available K through 12. The universities as a whole, as we spoke, are not required to provide special services. They are required to level the playing field. One of the biggest tendencies, and this is frequently encountered, and this is both documented in the literature, but also documented by many reports of students, is that frequently students who have received services K through 12, it's like, well, the experience is we got K through 12, we got those services, we graduated. It means that whatever was served, problem solved, issue addressed. Oftentimes the notion that upon entrance into college, students have tendency to, well, you know, we passed the admissions, we got into college, if we were able to graduate from college, obviously services may not be needed anymore. Maybe we've done this and we've moved on. College is a different thing. And then the very rude awakening takes place that not only are not services going to be brought to you, that they must be requested, documentation must be provided for them to be done, and that the onus in higher education is to level the playing field, to not provide specific services, but to simply guard against discrimination, is a very different framework than what they've dealt with before. And it is often very difficult for the families to adjust to this new framework. One of the things that I have seen in my professional career, and once again families talk about consistently, is a frequent scenario is you'll have a student with a non-obvious disability. They'll get their freshman year, and in the fall they struggle, and they have difficulty in several classes, They may get a few failing grades, get a few C's, get a few D's. Come the spring, halfway through the spring semester, the student finally approaches the Students with Disabilities office and says, man, I'm just having a hard time here, and I'm gonna need to get services. The problem is accommodations are not retroactive. So a student who was not successful in prior classes or in classes up to that point, even if a disability is documented, even if a disability is deemed eligible for the provision of accommodations, those classes still stand. So it is important, so important to stress to students and to families of youth with non-obvious disabilities that accommodations are not retroactive, that in fact they are only in place and affect the student's outcomes and their grades and their ultimate academic record only at the time in which they're put in place. Now, a bit of good news to this is oftentimes additional disability services that may be offered. For instance, several universities now offer programs for individuals who have conditions that lie within the autism spectrum. A lot of disability-specific services can't be paid for with financial aid. Once again, they have to be identified early on, and so oftentimes we often suggest that in students applying to higher education, that in addition to the admissions office, one of the first places that they contact at the university would be the Office for Students with Disabilities. One of the more famous quotes that I think belies this and is from Alexander Graham Bell, and Jade provided this quote. The only difference between success and failure is the ability to take action. That just re-stresses what and highlights what we said is don't wait. Accommodations are not retroactive. There's no need and there's no sense in having a struggle and aside from a GPA that you may not want. College is a time for exploration. Higher education is a time for exploration. It's a time to learn what your abilities are, how you fit within the greater context, with it, in what way can you achieve inclusion to the extent that you want. Struggling does not provide any facilitation toward that whatsoever. Take action early, preemptively, so that the effort and the energy that can be put forth to realize potential and realize goals, as opposed to spent time wasted when a simple accommodation could be provided. Job training provided under contract. Well, one of the things that we wanted to make sure we highlighted in this presentation, we talked earlier about inclusive design for learning. We talked earlier about making sure that accommodations were available. One of the things that we really wanted to highlight here was the provision of job training in those contractual services. One of the first point you see on this slide is something that we really, really want to make sure that is done, is to make sure that those contractors comply with federal and state laws and are held accountable. It would be disingenuous to say that all contractors are suspect, and that's not what we're saying. But what is important is we just highlighted that throughout the slides thus far, that many of these disabilities are non-apparent, and that there are stigma attached with non-apparent disabilities, and that there are inherent biases with disabilities that can't be readily seen, and that in the system that exists, those individuals must come forth to make the request for accommodations, to make requests for having their abilities understood. Make sure that the contract services that are provided not only just meet the state and federal laws, but take this inclusive approach, that look for and understand. If a contractor comes and they put forth to you, oh, we have this one very specific model that we have, this is our model, and we make sure that our students fit into this model, you should probably be suspect of that model. If a job trainer comes to you and says, okay, we look at each individual student, we try to make sure we understand what the student's learning style is, we try to make sure that we understand the student's abilities, and we really take students on an individual basis, then you're going in the right direction. One of the things that we need to do in order to get this, and we said this a little bit before, is you can't really do any of this without testing, without documentation. Because of disability, I myself have a visual impairment. Anyone that's ever been with me in a dark restaurant has watched me walk into a table or miss a corner or miss a step. At spending less than 15 minutes with me, it becomes readily apparent that I have a visual impairment. And it also becomes readily apparent what needs to be done. You need to take Brent's elbow when he's in a dark place, or else he will walk over people. The accommodation is quite readily ascertained and easily provided. Because non-obvious disabilities are not readily apparent, testing is the means by which you can determine the person's ability and the accommodations necessary to facilitate those abilities. We talked about this a little bit more about learning style. We want to make sure that engagement, representation, and expression are all understood. And once again, be wary and leery of templates that exist. This is the model, and this model serves everyone. If someone tells you they have a model that serves everyone, they probably have a model that serves almost no one. The best way, and this is the final point on this slide, but this is more of the overarching milieu that to be created to this, is to create a culture of support. And I think everyone watching this presentation already strives to engage in this, but it's difficult to overstate this, and it's also something that should be modeled to almost everyone that we come in contact with, which is a culture of support. And the example that we use on this slide is for tutoring, but basically many times, and I will say I'm happy about the university at which I work. I'm also affiliated with several service organizations that I think embrace and try to realize this, which is the provision of service, the facilitation of inclusion is considered to be a positive default way of understanding and dealing with everyone. So when someone is seen to be struggling in whatever area, instead of saying, well, are you sure you really need this? Is this justified? Have you, have you shown that, is your disability or is your struggle real? Instead of approaching anything like this, that's why we talked about earlier about how we use nomenclature and how we understand. Because a disability is non-obvious doesn't mean that it's not justified to receive services to facilitate inclusion. It doesn't mean that it's not real. And so by creating a culture in which support is the default, and to not question the validity or reality of a disability, but to simply say, I want to see you actualize your ability in the single best way possible. For instance, do you need a tutor? Then let's get you a tutor. Let's see if we can make this thing work so that you can reach your goals in the best way possible. By modeling, embracing, and insisting that be the approach, then job training or any other services you procure is going to go that much farther to guaranteeing the success of students with non-obvious disabilities.
Thank you, Brent. Now we'll touch a little bit on non-obvious disabilities in the workplace, because that disclosure piece is really critical. When you think about youth and supporting them for summer work and so forth, I think it's helpful to also know when and where it might be useful for them to disclose. Why disclose? Why do you even need to tell anyone that you have a disability? Sometimes identifying as having a disability means that you might have additional resources available to you or eligibility. For example, when you go to an America's Job Center, disclosing that you have a disability may bring up some additional programs that you're eligible for. It may be necessary to disclose to request accommodations and supports. Or, most importantly, if you're having performance problems and you think that accommodations may help you improve your performance, that is when it's really, really important to start that process. The whole point of accommodations or supports is to help you to be successful and to level the playing field. I think it's also important to note across all of these programs is that having a diagnosis or a term does not mean that an individual is automatically a qualified individual with a disability. Part of it depends on the setting and the impact. Does the asthma act up in that particular workplace and therefore perhaps requires an accommodation? Does it rise to the level? And so it's a very difficult process to navigate through. And that's where having some understanding of accommodations, settings, environments where accommodations can help you improve performance, and having learned what your learning styles are and strengths and accommodation needs are really, really important to capture that information. Workplace disclosure. If you choose to disclose, it may be helpful to share general information about your disability, why you're choosing to disclose your disability, and how it affects your ability to perform some of those key tasks. You may also want to include types of accommodations that have worked for you in the past and/or types of accommodations you anticipate needing. It's important to recognize that this isn't just a laundry list of all the wishes that you'd like. While accommodations are required to be provided, there's a process to go through, and you'll get what's appropriate to your needs, not necessarily what you may want. A reasonable accommodation is a modification or adjustment to a job or work environment that allows an individual to fully participate in all employment-related activities. However, you have to be able to perform the job with those accommodations. If you don't have the ability to perform the job with those accommodations, then you're not eligible to actually work in that position. Title I of the Americans with Disabilities Act requires businesses with 15 or more employees to provide reasonable accommodations. So therefore, it really applies across a broad blanket of business settings. The employer should pay for the accommodation unless it creates an undue hardship. An undue hardship means an action that requires significant difficulty or expense. However, the employer is not required to pay for the most expensive version if something that's less costly will work as effectively. When you're requesting a reasonable accommodation, it's important to engage in a conversation with the employer. Understanding the essential functions, fundamental job duties of the position, and how the accommodations you're requesting will allow you to perform those duties is really important. And particularly if you're working with youth, supporting them through this process so that they learn and can then, when they're hopefully adults in the workplace, can utilize this process is really important. Present your employer with resources about reasonable accommodations and options. Resources that are particularly helpful for you to look at and to refer to and to refer youth to are https://askjan.org. Jan has a wealth of information about the different types of accommodations that are out there and often have some innovative solutions, many times low cost, that can help an individual perform their best in a work setting. So, an individual needs to inform their employer if an accommodation is needed. They don't need to disclose if they don't require an accommodation. However, I do counsel individuals with mental health issues that perhaps if they anticipate at some point in time that they might have to request a leave, that they have a plan and that they self-disclose in advance and indicate what the plan is so that the employer will know who might be contacting the employer, where the information about login or projects and process are located. This helps to actually put the employer's mind at ease that if something were to come up, you would have it handled and they would have the information that they needed. And it's a way of proactively showing your value to the employer. But if you request an accommodation, you may need to provide documentation of the disability, and your doctor can actually provide that, taking the job description and asking the doctor to indicate are the places where you might require accommodations. It's also important to think about having a request for an accommodation when you're having performance problems and think that accommodations may help you improve performance. Again, accommodations are not retroactive. If you fail out of school or you're getting disciplined for work problems, waiting until you've reached the end of the line and then requesting accommodations aren't going to help at that point. So it's really important that as you start to encounter difficulties, that's the point at which you should request accommodations and go through the process in the hopes that they can help improve your performance. And again, an employer is only required to provide an accommodation if you ask for one. It's not the employer's responsibility to try and identify or figure out who might need one. So helping youth and family members who are entering the workforce to develop that ability and knowledge to be able to request those accommodations are really important skills. Here's an example of what a potential accommodation could look like. A cleaning company rotates its staff to different floors on a monthly basis. One of the staff has a psychiatric disability. While he's perfectly able to do the cleaning, he does find it difficult to adjust to alterations in his routine. So therefore, those monthly changes in floor assignments have proven difficult. The options that are proposed to his employer are to stay on one floor permanently, to stay on one floor for 2 months and then rotating, or allowing a transition period to adjust to the changes in the floor assignments on a monthly basis. All of those are ways of addressing some of the challenges that this individual has in adjusting to working on the different floors, all of which are reasonable, and there's no cost really involved in providing those accommodations. And it would help the individual to be successful as well as ensuring that the cleaning gets done and done well. A family member, a friend, a health professional, or another representative may be the one that requests the reasonable accommodation on behalf of the individual with a disability. And of course, an individual with a disability may refuse to accept an accommodation if they don't view that it's needed. It is important to also understand that the ADA makes it unlawful to discriminate against a person based on that person's association with the person with a disability. So family members who are caring for individuals with disabilities who are required to miss work can't be discriminated against merely by the fact that they have a family member with a disability. Now I want to touch a little bit on disability history and pride. As we know a great deal about the civil rights movement for minorities, it's important to note that the disability community has also worked very, very hard for the civil rights that the Americans with Disabilities Act granted them. In 1977, a group of individuals with disabilities held a sit-in in San Francisco, and it's still the longest takeover of a federal building in history. It went on for 28 days. There's a lot to be said for developing individuals' disability pride and the ability to self-advocate. We put a link to a toolkit. And I think it's also important to note that people with disabilities sometimes have acquired them. And so, therefore, it impacts a greater majority of the population. And being able to take pride and understand the history and embrace that concept of a disability is something that disability advocates have been advocating for many, many years. And it certainly has a rich history and culture, and it is something to be proud of. This figure is a path to disability pride, developed by LaDerek Horn and Margot Izzo as part of their book, Empowering Students with Hidden Disabilities, A Path to Pride and Success. It tracks what many people have walked through, which is the path of disability shame that they circle through before they're able to segue over into the steps to being proud of being an individual with a disability. These are important steps and information, and this is actually available as part of our toolkit as well. It's a helpful visual as you're working with individuals to be able to figure out where they might be in this cycle and how to help them move forward out of that shame to embracing that pride. Finally, disability does not define ability. Non-obvious disabilities means we do not always see just how many truly successful individuals there are. Let's not let stigma define anyone with a disability. Encourage those with non-obvious disabilities to share and become a positive role model. By seeing the individuals that are out there quite successfully working who have non-obvious disabilities, that becomes an important guide to demonstrate what is possible for those that may not be able to see it based on where they are in their lives just yet. Now let's go to our toolkit. Included in our toolkit is the financial aid fact sheet that talks about how disability costs can be included in your financial aid package. There's also a fact sheet around disclosure, how and when and where to disclose. Resources are included, such as where to get more information and training, as well as questions that you and your team, when you meet, can have to use to stimulate state and local discussions. Thinking about how and where some of these approaches might be utilized in your state policies, practices, procedures are important aspects to consider as you think about how you can improve the outcomes for youth on SSI and their family members. Again, for more information, you can go to www.mdtransitions.org, and we will have a link to APHSA with the webinars and the materials. With that, I want to give special thanks to APHSA, the Conference Edge staff, and the Maryland team. And here is our contact information. Thank you all very, very much.